Welcome to Nursing Related Philippine Jurisprudence, written and narrated by John Igor T. Calinato. This next case captioned Dr. Jarcia Jr. and Dr. Bastan versus People, GR number 187926, February 15, 2012. The facts of this case are as follows. A child named Roy was hit by a taxicab. The child was admitted to the emergency room. There was swelling on the right leg and misalignment of the right foot. The doctor ordered an X-ray only of the right ankle and did not include an X-ray of the right lower leg. As a result, the child wasn't treated and suffered in pain. A second X-ray was prescribed by another doctor of the right lower leg, revealed a mid-tibial fracture and a linear hairline fracture in the shaft of the bone. The doctors, Dr. Emmanuel Jarcia Jr. and Dr. Marilo Bastan, were criminally sued. The regional trial court found the doctors criminally liable for simple imprudence resulting to serious physical injuries and issued a warrant of arrest. The Court of Appeals affirmed the regional trial court in toto. The issue in this case is whether there is causal connection between the failure of the doctors to diagnose the fracture and the injury sustained by the boy. The Supreme Court ruled yes. The early treatment of the leg of Roy would have lessened his suffering, if not entirely relieved him from the fracture. A boy of tender age, whose leg was hit by a vehicle, would engender a well-founded belief that his condition may worsen without proper medical attention. As junior residents who only practice general surgery and without specialization, with a case consulted before them, the doctor should have referred the matter to a specialist. The omission alone constitutes simple imprudence on their part. When Mrs. Santiago insisted on having another X-ray on her child on the upper part of his leg, they refused to do so. The mother would not have asked them if they had no exclusive control or prerogative to request an X-ray test. Such is a fact because a radiologist would only conduct the X-ray test upon the request of a physician. The testimony of Mrs. Santiago was corroborated by a bone specialist, Dr. Takata. He further testified based on his personal knowledge and not as an expert, as he himself examined the child Roy. Res ipsa loquitur was also established in this case as a means of establishing evidence. Ordinarily, only physicians and surgeons of skill and experience are competent to testify as to whether a patient has been treated or operated upon with a reasonable degree of skill and care. However, testimony as to the statements and acts of physicians, external appearances, and manifest conditions which are observable by anyone may be given by non-expert witnesses. Hence, in cases where the res ipsa loquitur is applicable, the court is permitted to find the physician negligent upon proper proof of injury to the patient without the aid of expert testimony, where the court from its fund of common knowledge can determine the proper standard of care. In this case, however, the doctors were not held criminally liable, but only civilly liable for medical expense of 3,850 pesos, moral damages of 100,000 pesos, exemplary damages 50,000 pesos, or a total of 153,850 pesos. The doctors were acquitted of the criminal charge of reckless imprudence or simple negligence. The elements thereof were not proved by the prosecution beyond reasonable doubt. The testimony of Dr. Cirilio R. Takata, a specialist in pediatric orthopedic, although pointing to some medical procedures that could have been done by Dr. Jarcia and Bastan as physicians on duty, were not clear as to whether the injuries suffered by the patient Roy Jr. were indeed aggravated by the petitioner's judgment call under diagnosis or appreciation of the condition of the victim and the time they assessed him.